Hello everyone and welcome back to my channel. So I did a little poll on my Instagram and I wanted to see if people would be interested in a day in the life of a medical scribe video, and I got an overwhelming yes, so here we go. Hi, good morning. So it is about 8:30 right now. I would normally be in by work by like 8 about, but the provider I'm with today has telephone appointments and I think a hospital visit, so I don't have to be in until 10:10, so isn't that nice? So I'm with a new provider usually every day. I rotate between, I think there's like 15 where I work, but I rotate usually between about 10 of them, so it's a little hard to get used to their preferences. But it is kind of fun because I always switch it up. There's 6 different locations, so every day is kind of a new thing, so I never get too bored or too used to one provider or one location, which is kind of nice. But alright, I am gonna get up, I'm gonna get some coffee and some breakfast, make a little lunch because the provider I'm with today, usually we run a little bit late and start a little bit early, so I have to bring my lunch today, and then I'll update you as the day goes along. Hello, I am at work now. I just got a text message about like 30 minutes ago that this is going to be my 1 month evaluation, which means there's going to be somebody following me all day today, and I'm with a provider that she makes me do a little bit more than other providers. I'll explain. So it's going to be very stressful because I have to be on my top game and making sure I'm doing all the preventative care, which I do anyways, but I have to be super on top of it. So it's going to be a stressful day to say the least. Hello, so I am done with the first half of my day and I'm done with my assessment, so she only followed me for the first part of the day, luckily, because the second part is going to be super busy. We only saw 6 patients today because the provider was late, so it wasn't as chaotic. So for my assessment, she said that I was doing well with the HPI, which I'll explain with HPIs later. I needed to work on the ROS and then the treatment plans, but it's kind of hard because I'm being thrown around to different providers, so different providers want different things, so it's kind of hard to get used to that, but as I work more, I'm kind of getting used to the providers that I'm working with, so hopefully I'll just practice makes perfect, right? So essentially a work day for me looks like I start usually about 8:10, which is about 40 minutes before we see the first patient. So I'll go in, the provider won't be there, and I'll sit down and I'll prep the charts for the morning. So this means just verifying their medications, their history, their problem list, and then starting the HPI with like 27-year-old female presents for right knee pain, so whatever the chief complaint is. Since I can't show you real charts or how like my real day goes, HIPAA and all of that, I will put in like fake charts later and kind of explain what I do with the charts. And then, so for what I do, basically, if you've ever been to the doctor's office and you see the person standing next to the doctor typing super, super fast and trying to hear everything that you both say, that's me. So I'm just there. I get the lab results for the doctor if they need them. I pull up, different labs or diagnostic imaging results. So basically it's kind of, I just listen to whatever the patient says, and then I document the history, and then you also document what they're complaining of in the ROS, and then you document the exam after the visit's over. You go into the room and usually the provider will give me the exam and I'll write that down. Alright, so it's 1:30, so I usually go back in. The first patient usually comes in around 1:40, but we don't see them till about 2. I already prepped the afternoon charts at the end of the morning because we had a cancellation at the end, so we had more time. So what's kind of nice about scribing is you can prep your charts ahead of time. I could even prep my charts for tomorrow if I have time today, so it's less work. But yeah, it should be a busy afternoon. There's more physicals, more appointments that require more paperwork to put in, so it takes more time, but that's okay because it makes the day go by a lot faster. So it is about 6 o'clock, so I'm supposed to end at 5:30, which I don't have anything else to do. I don't have kids or family, so I'm perfectly fine with staying after because more money is nice. So I got done a little bit late because I offered to put in some paperwork, and we had a lot of patients that had a lot of like complaints and more physicals and stuff. So that was a really busy afternoon, and I'm so glad I wasn't being shadowed then, because not that I didn't do a good job, but it was just a lot. So I think one of the most difficult things about being a scribe is learning how to multitask. And you may think you're good at multitasking until it comes to this job, and then you realize, oh my gosh, this is overwhelming. Because you have to listen to what the provider is saying, what they're advising to the patients, and you have to listen to the patients and their history, and then you have to also put in like the assessments, and then order the labs under their assessments and put in referrals. So it's kind of, you want to do most of the chart before you even leave the room, so they can print that, the orders up and the referrals up for the patient when they get discharged. So it is a lot, and it is really overwhelming, especially at first. I didn't know how I was going to be able to even do it. I was like, oh, I've have CNA experience and all this experience, but this is just unlike anything I've ever done. So I think at first it's really frustrating, and you get mad at yourself because you keep forgetting little things, especially in the beginning when they're kind of evaluating all the time and they have just consistent just things to say, oh, you need to work on this, oh, you need to work on this. So it is really easy to feel discouraged at first, but all the providers at my practice and all the scribes that I work with are so nice, and if you ask them any question, they'll be more than happy to help. So they encourage you to ask questions, be open. They know that you're learning and this is something that you've never done before, and even the providers have questions about parts of your job, and they don't know how to do parts of your job. So everyone's kind of learning together and is super helpful. So don't get discouraged if you're starting out as a new scribe. I'm still lost. Of course I'm going to be lost. It's only a month in, but the scribes I talk to who have worked for years sometimes are still a little bit lost, because when patients come in, you may see the same thing over and over, but sometimes a patient comes in with something you've never seen before, and you have to order a lab you've never ordered before, so it kind of throws you for a new one, and you have to figure it all out. But they're super helpful, so don't get discouraged. You got this. So yeah, that's essentially my day. I come in, we have, about 13 patients in the morning average, 13 patients in the afternoon average, ranging from, so I work at a primary medicine clinic, so it's basically everything from stomach aches, follow-up from the urgent care, follow-up from hospital, diabetes, stuff like that. So it's very general. We see a lot of different things every day, and I basically just paired with one provider for the whole day, and I just follow them around and just write all the notes. So yeah, it's a great job. I think it is really good experience for PA school. Like I said, I have previous experience as like a CNA and a PT aide, and that was really good bedside manner. But this is really good medical knowledge and knowing how to take histories and do charts and all of that. So this is what the chart looks like. So when the patient comes in, the vitals will be done. The assessments are the different diagnoses that the provider puts in. And then the plan is what they're going to do about it. So if you order an ultrasound, the ultrasound will be under there, and you say, patient advised to follow up with ENT or whatever it may be. So where it says lab reports and diagnostic imaging is either where you order the diagnostic imaging or the lab reports from previous appointments. So we pull those over. If you see on the right where it says DRTLA or whatever those letters are, that's where all the previous labs will be. So you pull those over, and then you can put labs from 9/18/2019 were reviewed and discussed with patient, just to show that you did see those records and that you have reviewed those lab results with the patient. So when I first get into work, I go into the HPI and then I say 37-year-old male, put their chief complaint, and then I go and I verify everything. So it's just step by step. You verify their history, their medicine, their allergies. And then after that, when the patient actually comes in, I go to where it says templates. And if it's a physical, I have my own physical template that will bring over the ROS, the exam, and then we'll bring my attestation, which says my name, I'm a scribe, and then I'm scribing for whatever provider I'm scribing for that day. So I do that, and then I make sure that all of their lab results are in if they're there for follow-up labs, and then just make sure that the chart is ready and prepped for the physician or PA or NP or whatever to go in and provide care. So this is an example of a chart, obviously a fake chart that has the vitals, past lab results, and the exam in, so you can kind of see what it looks like when it's more completed. So I found this really good sample note of a note that's very similar to the ones that I take. It shows an HPI, which is the history. I do mine a little bit differently, but it's a pretty good, idea of what I do. And then it also shows the ROS, which is basically like the laundry list of the patient's complaints, and you put that in their words. And then the physical exam is what is in the provider's words. So if you're really interested in scribing, I would pause this video and read through everything, kind of get a gist of what, your everyday would be like, what information you're kind of putting in. I think this is a really good example, and it's something I wish I would have seen before going into scribing, so I had kind of a better idea of the things that I would be putting into charts. I hope this was helpful, and thank you so much for watching.